Well, today marks exactly 5 years since the World Health Organization declared COVID-19 a global pandemic. Since then, more than 1,200 Ottawa residents have died from the virus. A flag was lowered to half-mast at City Hall today to commemorate those who lost their lives. March 11th, 2020 was also the day the first official case of COVID-19 was confirmed here in Ottawa. Shortly after, schools shut down, lockdowns were implemented, and non-essential businesses were forced to close. Joining us now in studio to take a closer look at this 5-year anniversary, Dr. Paul Roumeliotis, Medical Officer of Health and CEO of the Eastern Ontario Health Unit. It's like it was yesterday, and yet it was like a lifetime ago. It was so strange, and everyone was trying to figure it out on the fly.
That was exactly, it seems like it was eons ago, but literally it was 5 years ago. It went by quick, but when you were in it, it didn't go by that quickly, right? And it was a time of not knowing what was happening, constantly changing, constantly, stressing everyone, and unprecedented closures, restrictions, vaccines, all that stuff we had never seen before. Although we had prepared for a pandemic, but we never had to do all these measures. But I must say, though, that, I felt very bad for businesses having to close down, people losing their livelihood. I really took that to heart. And of course, the lives lost. That was tragic. Fortunately, we were able to prevent a lot of deaths, and thanks to the vaccine and all the precautions. But I must say that one of the things that took me really aback was a lot of the miscommunication that was out there. But I think it was important for us to constantly, answer the questions when we could. And that was the other thing. We couldn't answer the questions.
Right. And you were in here trying. We had a special here in studio. Dr. Paul was in here answering so many questions from people who were all trying to figure it out. Some of that misinformation because we were learning more and things were changing. But what would you say is the big lesson that we're taking away from it in retrospect? What have we learned from dealing with an epidemic?
I think the big lesson is that we need to, first of all, be grateful to our healthcare workers, and our public health nurses and our staff did a great job. Of course, everybody else did as well. Communication, misinformation, I think was the most important thing in terms of us trying to get ahead of the misinformation and trying to clarify why we were making those decisions. I think that was the most important thing. And then realizing that, we can't take it lightly. When we close things down, there are unwanted consequences. We're seeing an increase in mental health issues, school closures, and so on. But on the other hand, I'm very happy that we had among the lowest death rates in the world of COVID. And if you compare it to the United States, it was 2 or 3 times higher, our death rate. So I think we did an excellent job. We're learning from that. We're learning how to be a bit less, blunt, if you like, use more of a surgical approach in terms of closures. But again, we did this for the betterment of our community. We wanted to protect our most vulnerable, and that was the bottom line.
And let me ask you that when it comes to protection, vaccine fatigue now, when we're talking about cases of measles, diseases that we had kind of dealt with that are creeping back into our, is that what we're left as a
And I think that's an unwanted consequence. Number one, we had, people with fatigue, hesitancy, but also don't forget we stopped vaccinating. Like all services stopped except everybody was doing COVID-related medical care. And so we fell, to 40% vaccination rate where we were 95% vaccination rate, particularly for measles, mumps, rubella. Fortunately, I can tell you the good news is that we're catching up. And so I know that we're getting a lot of measles cases, and that's because we're under-vaccinated. 9 out of the 10 cases are unvaccinated that we're seeing that, that have measles, but we're on our way up. So we're learning, about maybe we could preserve vaccinations or what can we do better in a pandemic when we have these restrictions.
Just in case we're ever in this position again, God forbid. Dr. Paul, thank you very much for your time then and now. As always, appreciate you.
Thank you.